Mechanism of action of cyanide. Cyanide poisoning result from inhalation of hydrogen cyanide, gaseous form, or ingestion of hydrocyanic acid, liquid form, or salt of cyanide, solid form. Mechanism of action. Inhibition of enzyme cytochrome oxidase at cytochrome AA3 portion, an important component of oxidative phosphorylation system in mitochondria, leading to reduced ATP production. Toxic effect of cyanides are attributed to production of histotoxic anoxia, CNS headache, anxiety, agitation, confusion, convulsion, coma, vertigo, faintness, prostration, CVS, hypertension and reflex bradycardia, tachycardia, hypotension, ventricular dysarrhythmia, respiratory system tachypnea, dyspnea due to stimulation of chemoreceptors and respiratory center, bradypnea due to severe respiratory depression, pulmonary edema, cardiogenic and non-cardiogenic, bitter almond odor of the breath, bitter GIT, bitter acidic burning taste, constriction or numbness of throat, nausea, vomiting, abdominal pain, skin, brick red discoloration of skin and mucous membrane due to increased hemoglobin oxygen saturation in venous blood, cold and clammy skin, cyanosis late feature, eyes glassy and prominent, unreactive and dilated pupil, kidneys, metabolic acidosis, accumulation of lactic acid, anaerobic oxidation of pyruvic acid. Diagnosis characteristic bitter almond odor, Lee Jones tents. A few crystals of ferrum sulfate are added to 5 ml gastric aspirate, followed by addition of 5 drops of 2% sodium hydroxide and boiled and cooled. Then add 10 drops of 10% HCl and observe color change. Greenish blue color indicates cyanide. Serum cyanide level normal level less than 0.004 milligram per deciliter. Treatment should be initiated once the principle to reverse cyanide cytochrome combination, which is achieved by converting hemoglobin to methemoglobin to giving a nitrate. This methemoglobin has higher affinity for cyanide, forming a non-toxic cyanomethemoglobin supportive. Remove patient at once to a fresh air if poisoning is inhalation. In cases of respiratory arrest, start Holger-Nielsen method of artificial respiration and oxygen administration. Gastric lavage using activated charcoal, 3% hydrogen peroxide, or 5 to 10% sodium thiosulfate, or 1:5,000 potassium permanganate, and 200 ml left in stomach. Exchange transfusion of blood transfusion if methemoglobin is more than 50%. Dicobalt EDTA 600 mg IV, chelate cyanide repeat 300 mg if recovery does not occur. If death is delayed, chemical antidote of 6% sodium carbonate, 15.3% ferrum sulfate, or 3% citric acid water is given to form a Persian blue. Keep a patient under observation. Specific antidote 3-step Lilly method. Break 0.2 ml of ambule of amyl nitrate in handkerchief and hold over nose for 15 to 30 seconds per minute per ambule. Inhalation of up to 6 ampules of amyl nitrate is recommended, followed by 0.3 gram of sodium nitrate in 10 ml of sterile water, given slowly IV over a period of 1 to 3 minutes. Then with the same syringe infuse 25 gram of sodium thiosulfate in a 50% solution over 10 minutes. Repeat nitrate sodium thiosulfate injection after 1 hour if needed. Thiosulfate converts cyanide to form non-toxic thiocyanate. Hydroxycobalamin 4 to 5 gram is infused IV. Vitamin B12. Detoxified cyanide by giving a hydroxyl group and then binding a cyanyl group form cyanide forming non-toxic cyanocobalamin, which is excreted in urine. Postmortem appearances. External bitter almond odor, bitter red postmortem staining characteristics, cyanosis of extremities, wrist glistening and prominent eye with a dilated pupil, froth at mouth and nostrils may be blood stained. Internal bitter almond color, particularly in brain tissue, bright cherry red color, blood color, blood stained froth in trachea and bronchi. Hemorrhagic gastritis followed by injection of cyanide, pulmonary and cerebral edema. Disseminated petechial hemorrhages in the brain, meninges, pleura, lungs and pericardium. Medico-legal significance. Cyanide is an ideal suicidal poison and is preferred because of instant and painless death. It causes homicidal use of cyanide is rare. Cyanide gassing is a mode of judicial execution in some state of USA. So treatment is remove patient at once to fresh air. Case of respiratory arrest, start a Holger-Nielsen method of oxygen administration, artificial respiration, gastric lavage using activated charcoal, hydrogen peroxide of 5 to 10% sodium thiosulfate, exchange transfusion if blood transfusion if methemoglobin is more than 50%, dicobalt EDTA, chelate, cyanide repeat 300 mg if recovery does not occur, dicobalt EDTA. If death is delayed, chemical antidote of 6% sodium carbonate, 15.35 ferrous sulfate, 3% acetic acid in water given to form Persian blue. Keep under observation. Then antidote amyl nitrate, sodium nitrate, thiosulfate, hydroxycobalamin. Thank you.